That tingling in your feet that wakes you up at night, that burning sensation in your hands that will not go away, that strange numbness creeping up your legs. What if I told you the very medication sitting on your kitchen counter right now could be causing all of it? Stay with me, because what you learn in the next few minutes could save your nerves, your mobility, and your independence. Here is something most people over 60 do not realize. As we get older, our bodies change in ways we can feel and in ways we cannot. Our joints get a little stiffer. Our energy dips a little earlier in the day. We might need reading glasses or hear the television a bit louder than we used to. These are normal parts of aging, and honestly, most of them we can manage just fine. But there is one change happening inside your body right now that you probably cannot feel until it is already doing damage. And that change involves your nerves, the very wiring system that lets you feel the ground beneath your feet, hold a coffee cup without dropping it, and know whether bath water is too hot. That system becomes more fragile after 60. And certain medications that millions of seniors take every single day, can quietly make things much worse. Hello, I am Dr. Clarence Martin. For over 20 years, I have helped older adults stay healthy, active, and independent. I have sat across from thousands of patients in my career, and I cannot tell you how many times someone has come to me saying, "Doctor, my feet are numb," or "Doctor, my hands tingle all the time." And when we looked closely at their medication list, we found the answer right there. Not a new disease, not a mystery condition. A pill they had been taking for months or even years, slowly and silently irritating their nerves. That is exactly what I want to talk to you about today. I am going to walk you through 6 commonly prescribed medications that are known to cause nerve damage in older adults. These are not rare drugs. These are not experimental treatments. These are medications that your doctor may have prescribed for very good reasons. Medications that help with diabetes, cholesterol, infections, heartburn, heart rhythm problems, and bladder infections. But every one of them carries a risk to your nerves that you deserve to know about. Now, I want to be very clear about something before we go any further. I am not telling you to stop any medication. Please do not do that. What I am telling you is that knowledge is power. When you understand what each drug can do, you can have a smarter conversation with your own doctor. You can watch for early warning signs. You can catch a problem before it steals your balance, your comfort, or your ability to walk without pain. Let us start with the first one, and this is a big one because tens of millions of Americans take it every day. The first medication is metformin. Metformin is one of the most commonly prescribed drugs in the entire country. If you have type 2 diabetes or prediabetes, there is a very good chance you have taken metformin at some point. It does a wonderful job helping control blood sugar. Doctors love it. Patients tolerate it well. In many ways, it is a fantastic drug. But here is what most people do not know. Metformin quietly blocks your body from absorbing vitamin B12, and vitamin B12 is absolutely essential for keeping your nerves healthy. Think of B12 as the protective coating around your nerve fibers, almost like the rubber insulation around an electrical wire. When B12 levels drop, that coating starts to break down. The nerves become exposed and irritated, and that is when you start to feel it. Tingling in the toes, numbness in the feet, a burning sensation that seems to come from nowhere. Some people describe it as walking on sandpaper or feeling like their socks are bunched up even when they are not wearing any. The tricky part is that this does not happen overnight. It can take a year, 2 years, sometimes longer for B12 levels to drop low enough to cause symptoms. By the time you feel it, the damage may already be significant. So what can you do? Ask your doctor to check your B12 level with a simple blood test. If it is low, a B12 supplement or even a monthly B12 injection can make a real difference. Do not stop your metformin. Just make sure your B12 is being monitored. Now, the second medication is one that probably half the people watching this video are taking right now. And the nerve damage it can cause often gets blamed on something else entirely. The second medication is statins. Drugs like atorvastatin, simvastatin, rosuvastatin. If you have high cholesterol or have had a heart attack or stroke, your doctor has almost certainly put you on a statin, and for good reason. Statins save lives by lowering cholesterol and reducing the risk of heart disease. But statins can also cause nerve problems. Research has shown that long-term statin use is associated with peripheral neuropathy, which is a medical term that simply means damage to the nerves in your hands and feet. The symptoms can look a lot like diabetic neuropathy: tingling, numbness, weakness, and pain in the extremities. Many seniors who take statins assume their nerve symptoms are just part of getting older or blame them on diabetes. But sometimes the statin itself is a contributing factor. The risk goes up the longer you take the medication and the higher the dose. This does not mean statins are bad. They are not. They are life-saving for many people. But if you have been on a statin for years and you are noticing new tingling or numbness in your hands or feet, bring it up with your doctor. There may be an alternative statin or a different dose that protects your heart without bothering your nerves. But the next drug on this list is the one that honestly worries me the most, because the nerve damage it causes can sometimes be permanent. The third medication is a type of antibiotic called fluoroquinolones. You might know them by their brand names: ciprofloxacin, which people call Cipro; levofloxacin, often called Levaquin. These are powerful antibiotics prescribed for urinary tract infections, sinus infections, pneumonia, and other bacterial infections. They work well, but they come with serious risks, especially for people over 60. The United States Food and Drug Administration has actually placed a black box warning on these drugs, which is the strongest warning they can give. One of the listed risks is peripheral neuropathy. These antibiotics can damage the nerves in your arms and legs, and in some cases, the damage can start within days of taking the first pill. What makes this even more concerning is that the nerve damage can be irreversible. Some patients develop permanent tingling, burning, or numbness that never fully goes away, even after stopping the medication. If your doctor prescribes a fluoroquinolone, ask if there is a safer alternative. For many common infections, there are other antibiotics that work just as well without the same nerve risk. And if you are currently taking one and you suddenly notice tingling, numbness, or burning in your hands or feet, contact your doctor right away. Do not wait for your next scheduled appointment. Now, the fourth medication on this list might surprise you because you can actually buy it without a prescription, and millions of seniors take it every single day without thinking twice. The fourth medication is proton pump inhibitors, commonly called PPIs. You know these drugs: omeprazole, which is sold as Prilosec; esomeprazole, sold as Nexium; pantoprazole, sold as Protonix; lansoprazole, sold as Prevacid. These drugs reduce stomach acid, and they are prescribed for heartburn, acid reflux, and stomach ulcers. Many people start taking them and just never stop. Here is the problem. When you take a PPI for a long time, it interferes with your body's ability to absorb certain nutrients, including vitamin B12 and magnesium. We already talked about what happens when B12 drops. Your nerve coating starts to deteriorate, but low magnesium is also dangerous for nerves. Magnesium helps regulate nerve signals throughout your body. When levels fall too low, you can experience muscle cramps, twitching, numbness, and tingling. I have seen patients who took a PPI for 5, 10, even 15 years. Nobody ever told them it could affect their nerves. Nobody checked their B12 or magnesium levels. And by the time they came to see me, they had significant neuropathy that could have been caught years earlier. If you have been on a PPI for more than a few months, talk to your doctor. Ask whether you still need it. Ask for blood work to check your B12 and magnesium. Sometimes a simple lifestyle change, like eating smaller meals, avoiding late-night eating, or raising the head of your bed, can control acid reflux without medication. We have covered 4 drugs so far, and I hope this information is already opening your eyes. But the next one I want to tell you about is a medication prescribed for a very serious heart condition, and the nerve side effects often go completely unrecognized. The 5th medication is amiodarone. Amiodarone is a drug used to treat irregular heart rhythms, a condition doctors call atrial fibrillation or arrhythmia. It is a very effective drug, and for many seniors with dangerous heart rhythms, it can be a lifesaver. But amiodarone is also one of the most toxic medications in common use. It can affect the thyroid, the lungs, the liver, the eyes, and yes, the nerves. Peripheral neuropathy from amiodarone typically develops slowly over months or years. The drug accumulates in nerve tissue and gradually causes damage. Patients may notice weakness in their legs, difficulty walking, numbness in their feet, or a feeling of unsteadiness. Because amiodarone is usually prescribed for a serious condition, stopping it is not always an option. But monitoring is essential. If you take amiodarone, make sure your doctor is checking your nerve function regularly. Report any new numbness, tingling, or weakness right away. There are sometimes alternative heart rhythm medications that may carry less nerve risk. Now, the sixth and final drug on this list is one that is especially common among older women, though men can be affected too. And I see this one cause problems more often than most doctors realize. The sixth medication is nitrofurantoin. This is an antibiotic used to treat and prevent urinary tract infections, which are very common in older adults, especially women. Many seniors are prescribed nitrofurantoin to take on a long-term basis to prevent recurring UTIs. Here is the concern. Nitrofurantoin can cause peripheral neuropathy, particularly when taken for extended periods. The risk is even higher in people who have reduced kidney function, which is extremely common in adults over 60. When the kidneys cannot clear the drug efficiently, it builds up in the body and becomes toxic to the nerves. Symptoms can include tingling and numbness in the hands and feet, muscle weakness, and sometimes pain. In severe cases, the nerve damage can become permanent. Current medical guidelines actually recommend against using nitrofurantoin in patients with significantly reduced kidney function. Yet, I still see it prescribed in these situations more often than it should be. If you take nitrofurantoin regularly, ask your doctor to check your kidney function. If your kidneys are not working as well as they used to, there may be a safer antibiotic option for you. So let me take a moment now and explain what is actually happening inside your body when these medications damage your nerves. I want to keep this simple because understanding the basics will help you recognize problems early. Your body has a vast network of nerves that runs from your brain and spinal cord out to every part of your body. These are called peripheral nerves. They carry signals that tell you when something is hot, cold, sharp, or soft. They tell your muscles when to move. They help you keep your balance when you walk. Each nerve fiber is wrapped in a thin protective layer called the myelin sheath. Think of it like the plastic coating on an electrical wire. When that coating is healthy, signals travel quickly and clearly. But when medications strip away that coating, or when they damage the nerve fiber itself, signals get confused, slowed down, or blocked completely. That is when you feel tingling, burning, numbness, or pain. That is when you start to lose your balance. That is when your grip weakens and you start dropping things. The reason seniors are especially vulnerable is that after 60, your nerves naturally become a little slower and more fragile. Your kidneys and liver, which process and clear medications from your body, also slow down. So drugs stay in your system longer and at higher concentrations. This means the same dose that was perfectly safe at age 40 might be causing silent damage at age 70. Now I do not want to leave you feeling scared or helpless. That is not why Dr. Clarence Martin made this video. I made this video to empower you. Because there are real, practical things you can do every day to protect your nerves and keep them healthy as you age. Here are 6 simple habits that can make a real difference. First, keep a complete and updated list of every medication you take, including over-the-counter drugs and supplements. Bring that list to every doctor's appointment. Ask your doctor at least once a year whether you still need each medication. Second, ask your doctor to check your vitamin B12 and magnesium levels regularly, especially if you take metformin or a PPI. These are simple blood tests, and catching a deficiency early can prevent nerve damage before it starts. Third, stay physically active. Walking, gentle stretching, swimming, or light exercises improve blood flow to your nerves and help keep them healthy. Even 15 to 20 minutes a day can make a difference. Fourth, manage your blood sugar carefully if you have diabetes. High blood sugar is one of the biggest causes of nerve damage in seniors. Combined with medications that also stress the nerves, uncontrolled blood sugar can accelerate the problem significantly. Fifth, Eat a nerve-friendly diet. Foods rich in B vitamins, like eggs, fish, poultry, dairy products, and fortified cereals, support nerve health. Leafy green vegetables, nuts, and seeds provide magnesium. A colorful, balanced diet gives your nerves the raw materials they need to repair and protect themselves. Sixth, pay attention to your body. Do not ignore new symptoms. If you notice tingling, burning, numbness, or weakness in your hands or feet, do not assume it is just aging. Write down when it started, where you feel it, and what makes it better or worse. Then tell your doctor. Early detection is the key to preventing permanent damage. Now I want to hear from you. Drop a comment below and tell me your age and where you are watching from today. I read these comments, and it truly means the world to me to know that this information is reaching the people who need it most. Whether you are in Texas or Florida, Ohio or California, New York or anywhere else, I want to know you are out there taking charge of your health. And if any of the medications I mentioned today sounded familiar, if you recognize something you are taking right now, please do not panic. Remember, these medications were prescribed for a reason. They are helping your heart, your blood sugar, your digestion, or fighting an infection. The goal is not to stop them on your own. The goal is to work with your doctor, to ask the right questions, and to make sure your nerves are being protected while your other health conditions are being treated. You have lived a full and incredible life to get to this point. You have earned the right to feel good in your body, to walk without pain, to hold your grandchildren's hands and actually feel the warmth of their skin. That is what healthy nerves give you. That is what I want for every single person watching this video. Getting older does not mean giving up. It does not mean accepting pain and numbness as normal. It means being smarter, being more aware, and being your own best advocate. And today, by watching this video, you have already taken a powerful step in that direction. I am Dr. Clarence Martin, and I am proud of you for being here. If this video helped you, please hit that like button. It only takes a second, but it helps this video reach more seniors who need to hear this information. Subscribe to this channel so you never miss a new video. I release new senior health tips regularly, and I do not want you to miss a single one. And if you have a friend, a spouse, a sibling, or a neighbor who takes any of the medications we talked about today, please share this video with them. You could be the reason they catch a problem early and protect their health. Thank you for watching. Thank you for trusting me with your time. Take care of yourselves, and I will see you in the next video. This video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your personal physician or qualified healthcare provider before making any changes to your medications or health routine. Never stop or change a prescribed medication without first speaking to your doctor.